I think the one thing that I've learned over the 10 plus years that I've been practicing medicine is that you always need to listen to the parent. No matter whether the child fits into a certain box from a medical diagnosis standpoint, if the parent really says that there's something going on with the child, you need to listen. There have been a number of diagnoses that I've made just because I've listened to that parent's gut, and we've arrived at a sooner diagnosis, faster treatment, and good outcomes. Before I started working for Sharp-Rees-Steely, I worked at a children's hospital on the inpatient unit. And so I was what was called a hospitalist. So I took care of children who were admitted to the hospital. And I did that for 6 years. And I think that gives me an extra skill that might not be common in the general pediatric setting, where I can identify sick very quickly, arrange for the proper treatment to be made, admission if necessary, and just help the family navigate through that whole process. One of the moments that I've been the most proud of as a physician is when a patient comes and tells me that something I've done to help them made an impact in their life. Last week, an adolescent teenager girl who came for anxiety and depression a few months back couldn't get into counseling, didn't have a good support group at home. And so I saw her initially every week, and then every couple of weeks, and then every month. And last week she came in, no depression, no suicidal thoughts going through her head, and she just felt better, and now she's off to college, and gave me a big hug and just said thank you. And that's the absolute best part of my job. Sometimes a patient encounter means that there's a parent who's worried that something could be severely or critically wrong with their child, and it's not just taking care of the patient, but taking care of the parent as well, helping them understand what things to worry about, what things not to worry about, and making sure that if there is something to worry about, that we take it on together. I think what my patients and their families value from me is that I go to bat for them, I advocate for them. The medical system can be difficult or confusing sometimes, and to have somebody fighting for you on the back end to make sure that your child gets the care that they need and the care that they deserve, I think that's something that my patients value very much. To have a genuine connection with my patients it's the best part about my job. To be able to be a part of their family, a part of their team, help them navigate becoming the best physically and mentally healthful family that they can. It's just such a joy and such a privilege. It's why I go to work every day.